has been grappling with the challenges of the health service since he started his career out in 1978 in Manchester here. So John led the Whole Person Care Commission over the back end of last year and into this year, looking precisely at this same area with a large number of senior figures from the health service and beyond, to see what could we be doing differently as we look forward to the next government and indeed into the middle of this century. So John, if you'd like to give your summary of your position from your report.
Thank you very much, Jeremy. My guess is that each and every one of you in this room can bring into your mind's eye someone now you know, who you care for maybe, who has multiple problems and multiple needs. And you and they will have experienced the fragmented system that currently addresses that, where we end up with what I call a Monty Python-esque queue of people outside a person's house dealing with body parts when the person wants to be dealt with as a whole person. And that person in your mind's eye, you multiply by 252%, that is where we are in 2050. The system is geared more around the demands of 1948 than what we now meet in 2014. As it currently stands, it's not sustainable. Change has to happen. It's also a poor experience, and I would argue as a clinician, poor and unsafe care. In our report, we started with an understanding of what people themselves were asking for and wanted. And if I had to put it in a summary sentence, it is, I want you to treat the whole of me, and I want you to act as one team. And that starting point, with that person in our mind, was what then led us to how can we make the system respond rationally to the demands that are now upon it. And we did so by starting with the people, not the institutions. And if I had to say there were three principles, it would be these: giving meaningful power to people using the system, reorienting the whole system around whole person care, and addressing the biases in the system that time after time have prevented it happening. The latter doesn't get headlines, doesn't grab attention, but I have to tell you, in my view, is the most needed and the least done. Health and care is a people business. Relationships trump structures every time. And it was our view that at this particular moment, we shouldn't focus on what the structures are, but the relationship between them, the people who work for them, and what they do. That is not to say that the structures are right and they won't change, they aren't and they will. But it was our view that currently the system could not sustain another major structural upheaval, and we made recommendations that could achieve significant integration of health and social care without that necessity. So we addressed it in a number of ways, and I'll just give you a glimpse. First, providers of care. Let us start with an understanding that people who have multiple problems themselves have to look after their own care for some 8,000 hours in a year, and we professionals will interface with 3 to 4. Wouldn't it be a good idea if the system empowered them with the knowledge to help them in that 8,000 hours, as well as all the other changes you might want to make to providers? But let's start with there. Secondly, actually getting the right people working in the right way. Starting at the beginning and getting people understanding multidisciplinary team working, having local integrated teams doing health and social care, not new people, but the same people working differently, with one person acting as the coordinator for the totality of the care for an individual, so they know who to go for. Getting information as a core service. And let's start there with giving the legal ownership of health and care records to us as individuals, not the Secretary of State. Making the money work. Health and wellbeing boards seem a natural repository to us for jointly agreeing a commissioning plan between health and social care which the existing commissioners can enact, but change the financial flows in the system which currently pull people in different directions to abandoning payment by results, and pardon the jargon, but effectively it means payment by activity for hospital sector, and instead have a year of care tariff whereby the totality of your care attracts a single fee which the whole of stakeholders then have to agree the goals on and work towards the same goals for. Making people more independent more of the time, the preventive stuff which I know many of you will know I won't get into, but also the wider system changes, addressing those biases that I mentioned. Training boards, it might surprise you to know, for the whole of the medical profession is dominated simply by people who come from the hospital sector. It doesn't get input from community services, primary care, let alone social care. And yet that effectively locks in a system which we need to change. NHS England. Let's have more people from local government on the board of NHS England. Let us move away from the ridiculous situation where we have 18 national clinical directors of body parts, when in fact 70% of the activity of the health and care system are people with multiple properties, and the bias in policy generation that concludes. So that's just a glimpse, and I hope it says to you that this isn't a single lever, it's multiple levers pulled at the same time. This is not pick and mix, this is looking at different parameters and in an integrated way implementing them. Everything in our report is implementable within a lifetime of a single parliament, the majority of it without legislation. It's a doable, practical proposition. Kate's gone into the money, I won't dwell on it. But what I will say to you is this, that we cannot go on as we are. Unless we fail, unless we change, we will fail. Not the healthcare organisations, not the social care organisations, not the government of the day, not the Labour Party, not the NHS as an institution. We will fail those people you brought into your mind's eye, our friends, our relatives, our communities, and we must steel ourselves not